Aciphex is used to treat certain stomach and esophagus problems such as acid reflux ulcers. It works by decreasing the amount of acid your stomach makes. It relieves symptoms such as heartburn, difficult swallowing, and cough. This medication helps heal acid damage to the stomach and esophagus, helps prevent ulcers, and may help prevent cancer of the esophagus. Rabeprazole belongs to a class of drugs known as proton pump inhibitors. Active ingredient rabeprazole sodium. Indications: healing of erosive or ulcerative gastroesophageal reflux disease, maintenance of healing of erosive or ulcerative gut, treatment of symptomatic gut, healing of duodenal ulcers, Helicobacter pylori eradication to reduce risk of duodenal ulcer recurrence, treatment of pathological hypersecretory conditions including Zollinger-Ellison syndrome. How to take Aciphex. Take Aciphex exactly as prescribed. Do not change your dose or stop taking Aciphex unless you talk to your doctor. Take Aciphex for as long as it is prescribed, even if you feel better. Aciphex is usually taken once a day. Your doctor will tell you the time of day to take Aciphex. Aciphex can be taken with or without food. Swallow each Aciphex tablet swallow with water. Do not chew, crush, or split Aciphex tablets because this will damage the tablet and the medicine will not work. Tell your doctor if you cannot swallow tablets whole, you may need a different medicine. If you miss a dose of Aciphex, take it as soon as possible. If it is almost time for your next dose, skip the missed dose and go back to your normal schedule. Do not take two doses at the same time. Take Aciphex exactly as prescribed by your doctor. Follow the directions on your prescription label carefully. Your doctor will determine the right dose for you based on your medical condition. The recommended dose for Aciphex is 20 mg once daily for 4 to 8 weeks. Your doctor will tell you how long to take Aciphex. Contraindications. Aciphex is contraindicated in patients with known hypersensitivity to rabeprazole, substituted benzimidazolase, or to any components of the formulation. Hypersensitivity reactions may include anaphylaxis, anaphylactic shock, angioedema, bronchospasm, acute interstitial nephritis, and urticaria. Precautions. Before taking rabeprazole, tell your doctor or pharmacist if you are allergic to it or to similar drugs such as lansoprazole or omeprazole, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of liver disease, lupus. Older adults may be more sensitive to the side effects of this drug, especially bone loss and fractures. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. Side effects. Serious side effects have been reported with Aciphex. Common side effects with Aciphex include the following: headache, pain, sore throat, infections, constipation. People who are taking multiple daily doses of proton pump inhibitor medicine for a long period of time may have an increased risk of fractures of the hip, wrist, or spine. This is not a complete list of Aciphex side effects. Ask your doctor or pharmacist for more information.